Hi, I am Dr. Prasad. I'm Senior Consultant Internal Medicine and Diabetes at Apollo Hospitals. Today, I want to highlight a little in detail about the diabetes as a non-communicable disease. So we all know diabetes is alarmingly rising in the country, globally as well. So we see around 500 million diabetic patients across the globe. So looking into a little specific about the epidemiology of diabetes, what we have identified is the rise in numbers of the urbanization and as well as the sedentary lifestyle causing the increase in numbers. Along with that, you put up the aging population. So we see a lot of aging population who are adding to the diabetic population as a whole across the globe. So what is important at this point of time is identifying a diabetic patient at the earliest. So we come across diabetes as a non-communicable disease. It could be secondary to a genetic trait where someone's genetically susceptible could develop diabetes, or could be because of obesity or all the environmental factors like the reduced physical activity or a high-calorie dense diet, which pushes a patient in becoming a diabetic. So right now at the outset, what we really need is screening an individual. Anyone about 30-35 years who are highly susceptible or who has got a genetic trait or a genetic predisposition to develop diabetes has to be screened at the age of 30 or 35 years. From then on, yearly or once in 2 years, and then someone who's obese, someone who's G, had a family history of diabetes and a gestational diabetes. A lady who's been having diabetes in pregnancy, called a gestational diabetes, also needs a screening follow-up down the years beyond the age of 30 to 35. So this early screening for diabetes helps to identify the high-risk individuals from becoming a diabetic. So once you pick them up quite early, if they pick them on the early pre-diabetic state, you can still push them to an aggressive lifestyle modifications in terms of your diet, in terms of physical activity, in terms of your weight loss, which could still keep the patients in a pre-diabetic or could even put them into a diabetic remission phase where they still be a non-diabetic without the need of medications, without the need of any onset of complications. All these things could be prevented. So they can still be in a C, in a period where they still enjoy a period where they do not need medications, and the onset of complications could be prevented. So this is the role or an awareness which should be created with the public and as well as high-risk individuals, elderly population, where they could be screened early, prevent the onset of diabetes, and even if they're detected to be a diabetic or undetected diabetic, we treat them early. Why do you need to treat them early? You prevent the onset of complication. Diabetes is not a number. We are not treating the numbers here. We are trying to prevent the onset of the complications. This could be a small complication like a microvascular, complications like diabetic neuropathy, nephropathy, or eye-related retinopathy, or could be major complications like a cardiac-related atherosclerotic cardiac disease or a stroke, or something related to the foot called the peripheral vascular disease. So why this is very important as an awareness, or if globally, to prevent the onset of complications? Number one, this is going to put a huge burden, financial and health burden, not only to the individual, also to the family, also to the state, also to the country, and as well as globally. This is going to reduce the reserve of the active individuals. If someone is being detected with diabetes and with complication, it is going to reduce the reserve or the quality of life of an individual, thereby reducing the productivity of a young individual. So all these things could be prevented if the individual is identified early and started on the medications if needed at the appropriate time. Yeah. So that's the role of early detection of the non-communicable diseases, especially diabetes, and more so also with hypertension as they all go coexisting together. So if you can identify them at the earliest, we prevent the onset of complications and help the individual lead a healthy life, and as well as make sure that the complications onset also could be prevented. At Apollo Hospitals, we are able to offer the screening with doing the mass health checkups, where we pick them up early. The high-risk individuals, not only the high-risk individuals, someone related to the families who are related to them, are also screened quite early, so that you pick them up early, start medications early, screen them for complications. If there is an undetected complication which is certain, these could be identified early to prevent the progression of these complications, delaying the complication to progress, and thereby you can help them lead a healthy life in the long term. Thank you.